How does kidney stone surgery, ureteroscopy, work? And how to prevent more stones? This is Jared J. Wallen, MD, board certified urologic surgeon and men's sexual health specialist. Again, you can see our list of websites here to find us and look for more content. How does kidney stone surgery work? Well, typically what happens is that the anesthesiologist will essentially put the patient to sleep in the position on the OR table. The patient will be positioned in essentially kind of stirrups with their legs kind of spread out and in safety stirrups to help them support them and allow the surgeon to get the best access possible to the bladder and kidney through the urethra and ureter tubes, which are easily navigated with tiny little scopes like this one, the LithoVue disposable ureteroscope from Boston Scientific. The reality is once you're asleep or shortly before there, actually, you'll get a dose of antibiotics to help prevent infections. And then after sterilely cleaning and prepping the area for each patient, the patient will be draped out with sterile drapes to make sure that we have the most sterile field possible. And ultimately after that, what happens is that a tiny little camera called a cystoscope goes into the bladder. Typically a little wire is passed up into the kidney, and usually we take some x-ray pictures to see if we can see your little stones and also confirm that we can see your kidney and the little wire that's present. And then possibly even through a combination of an access sheath or even just over the wire, the ureteroscope is passed up into the kidney. And thankfully these little ureteroscopes, you can see here that there's a little attachment on the top of it, and you can see this wire extending out of it. That's called the working channel of the ureteroscope, and that allows us to pass a number of different instruments, including a laser, including a basket, including other wires, or even squirting some contrast dye to take x-ray pictures and look and see if the kidney is swollen, or see if we can find where other stones are. That allows us to use multitude of different techniques to both visualize, break up, and remove your stones. And so essentially what's done is that an x-ray picture is taken with some dye. The camera is navigated up into the kidney, as you can see here on the diagram. And ultimately what happens after that is that the stones are visualized directly on the camera. And once you visualize the stones, then ultimately we pass a little laser through this little working channel. Use the laser to break the stones into multiple small pieces and fragment them, and then use the little basket to essentially grab all those little pieces and remove them. You can see here on this ureteroscope the Empower device, which is also made by Boston Scientific. It is a device that actually essentially just kind of snaps onto the ureteroscope. This is your ureteroscope by itself. This is the ureteroscope with the Empower device connected, and that Empower device allows us to use this little basket, slide it through the working channel, and it comes out the end of the scope. And essentially what we can do is we can navigate your scope, find your stones, and then we can also use the little device to open and close the basket and grab the little pieces of stone and remove them. After that, again, usually what happens is that we squirt some more contrast, make sure there's no leakage of the contrast or damage to the little ureter tube, and also further evaluate for any other stone fragments or pieces by navigating through the kidney with the ureteroscope to see the entire portion of the upper, lower, and interpolar regions of the kidney. This also allows us to navigate through the little tube as we leave and ensure that there's no fragments left behind inside your tube either. Ultimately at this point another picture is taken, and usually what's called a little ureteral stent is placed in afterwards just to allow the kidney to drain easily without any swelling issues and be relaxed while you're recovering for a few days. Again, this is typically done as an outpatient procedure. Usually you go home after a short period in the recovery area, and then most often within about 5 to 10 days we would have you come back to the office and remove the little ureteral stent and be done with the kidney stone treatment. Ultimately afterwards, however, if you have one stone, you've got about a 50% chance of having 2 stones or a second stone within the next 5 years or so, And so ultimately afterwards, it's pretty routine for us to, number one, get an ultrasound to make sure that the swelling has resolved in your kidney, and number two, get a 24-hour urine study to ensure that we know what's going on in your urine that could be potentially predisposing you to more stones. Things like alterations in your pH, things like alterations in your calcium levels or oxalate levels or uric acid levels, or all these different types of little metabolites that can essentially crystallize and then form stones. We check on all of that with a sample of urine from you for a collection from an entire day, and then we make recommendations as far as how to keep you safe. Remember, for a typical kidney stone diet is essentially three things, right? Basically, it's water, 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 and that equates to about 4 to 5 liters of water a day at least. Certainly if you live in a hot, humid environment like Florida here, you may even have to drink more than that during the summer months. Again, the whole goal is to get about 3 to 4 liters of urine a day, so that way you can flush out all the little metabolites, and all the little metabolites stay dissolved in your urine rather than crystallizing and forming stones. And so from that standpoint, water is very important. Water is your best friend for any kidney stone patient, and actually most people. Most people truly need to drink more water, and we typically recommend about 6 to 10 glasses a day. Again, actually more than that for kidney stones, up to 4 to 5 liters of water a day. Beyond that, the second item would be essentially a healthy diet. So low salt, low sugar, and actually nowadays we're finding more and more that animal proteins are also a risk factor for stones. So essentially low salt, low sugar, and a plant-based diet. And the final thing is citrus juice. Citrus juice can be very, very helpful at preventing stones. Essentially what that helps to do is to balance out the pH in your urine and in your body. And citrate, which is in citrus juice, is also a preventer of stones. And so from that standpoint, 4 ounces of citrus juice every day is also recommended, other than the water and the healthy diet. And so that essentially can be any number of, or any combination of grapefruit, lime, or lemon juice. I typically don't include orange juice in that because there is so much sugar in orange juice. And so from that standpoint, again, we already talked about trying to follow a low sugar diet as well. The citrus juice can be diluted in your water and added as flavoring, or I specifically have one special patient who essentially pours himself 4 little 1-ounce shot glasses every morning of citrus juice, and essentially drinks 4 little shots of citrus juice every morning and flushes it down with a bunch of water to essentially kind of get the bitter taste out of his mouth and so to speak, swallow the frog right away early in the morning.
A healthy heart and kidney diet consists of 3 to 5 liters of water a day, low salt, low sugar, 4 ounces of citrus juice daily, avoiding smoking and excessive drinking, removing meat from your diet, and about 40 minutes of cardiovascular activity 5 days a week. Thank you for watching our video, How Does Kidney Stone Surgery Ureteroscopy Work? And how to prevent more stones. Again, this is Jared J. Wallen, MD, board certified urologic surgeon and men's sexual health specialist. Thanks for watching our content.